How do you test your hormones? This is a question I get asked so often, it's not even funny. And so tonight I want to break down for you how you test for your hormones and different things that you should think about when you're getting hormone testing, because unlike traditional doctors will tell you, you can actually test your hormones and get the answers that you need so that you can get the treatment that you need. So I want to take us through blood testing, urine testing, and saliva testing, because those are the most common routes of ways that we check our hormones. And I want to talk about why you pick one over the other. And then I'm going to kind of talk about my unique approach and what I do. And then we're going to talk through a couple of things to wrap it up. And then I'll take some case questions if anybody has some. So first of all, when I'm talking about hormones, I don't just mean sex hormones like estrogen, progesterone, and testosterone. I mean things like your adrenal hormones and even things like your thyroid hormones. One thing that I like to talk about is the fact that your hormone system is like a three-legged stool. So they all work together, all of your hormones, your sex hormones, your adrenal hormones, and your thyroid hormones. And if the stool, if one leg is shorter than the other, the stool is going to tilt and things are going to get off. And so what commonly happens is that you have all of the other systems affecting each and every other system. So when someone says, oh my goodness, I'm adrenal fatigued, or I have adrenal dysfunction, or, I have really high estrogen, or my progesterone is low, whatever it is, you can know that hormonal effect is also going to affect the other hormone systems. They don't operate in a vacuum. Your adrenal glands aren't just the only ones affected, or your female sex hormones are not the only ones that are affected, or it's not just your thyroid. And that kind of leads me to something that I should tell you guys about in terms of treatment. Because when we're thinking about all of those hormone systems, I'm just realizing that I have some ink from my printer. That's what that is. When we're thinking about these three hormone systems, it's important to treat them in a certain order. So, for instance, I think of it as a triangle, kind of like the old food pyramids, with the carbs on the bottom. So the adrenal glands are going to be the bottom of the bottom of the pyramid, and then your thyroid gland is next, and then your sex hormones are the tippy top triangle. And so what this represents is the fact that if you have adrenal dysfunction, that might affect your thyroid function, and that is definitely going to affect your reproductive hormones, your sex hormones. And one thing that is very common in hormone land is that generally people have symptoms either in all three categories that kind of overlap. So it's really easy to kind of think that, I just have issues with my progesterone, or, I just have issues with my adrenal glands. But it's actually, they're all connected, and a lot of the symptoms can overlap. So what's common is that, say somebody is having issues with fertility and they're thinking, my issues are all about the female sex hormones, that's where my problem is. Sometimes it's actually the layers before the actual sex hormones. It's actually the adrenal glands or the thyroid that's causing the problem. And so whenever I'm sitting down with somebody and they're complaining about hormone issues or whatever it is, I always think first about the adrenal glands, and then about the thyroid, and then about their female sex hormones, because it's one example would be thyroid issues, especially hypothyroidism is really, really common in this country, especially in women. And one thing that tends to happen is that if a woman gets diagnosed with hypothyroidism, oftentimes their doctor will put them on a medication like a thyroid hormone replacement, which is awesome. We want that. But what commonly happens is that sometimes other issues are not addressed. And so when we put a woman on thyroid hormone, she might initially feel better, and then she kind of feels like she has her hypothyroid symptoms back again. And one of the reasons why that can happen is because in the background, something that they don't know about is the fact that they have some adrenal dysfunction. They have some low functioning adrenal glands. They're maybe not creating enough cortisol, or they have too much cortisone, or their DHEA is off. Something's off with their adrenal glands. And when your adrenal glands aren't doing well, you can have an exacerbation of your thyroid symptoms, and sometimes some of your thyroid symptoms actually kind of masquerade as they're actually more so adrenal symptoms. So it's really important to think about the triangle when you're thinking about, hey, what do I actually need to treat? What do I need to get tested? Where do I start? And so one spot that I usually will start with is looking at people's adrenal glands. And you don't have to do a test to assess for adrenal function. A really good history tends to help. If somebody is having changeable energy levels throughout the day, if they're wired and tired at night, if they can't sleep through the night, if their energy is just kind of low no matter what they do, if they are tending to crave things like fat and salt, if they don't really recover from exercise well, if they're getting more infections than normal, if they had a period of stress past in their past life, or recently in the past, then those people most likely have an adrenal issue and they need to treat that. But if you're feeling that way in general, then we know that's going to affect how your thyroid gland functions and how your ovaries function. So really important to think about the order by which all of your hormones interact. So always think about the adrenals being affected first, then thyroid, then sex hormones. And so when I am doing testing with people, so let's talk about testing now, because there's 3 different ways that we can test for hormones. Probably the most common one is blood, and blood is just a blood test that you get from any doctor. Can order these labs. It's really, really common. And a whole hormone blood panel. I actually did a post on this a couple of posts back on my Instagram, so definitely go look at that. But if we do a whole blood panel on you of your hormones, then what we get to see is what your hormones were functioning at in that moment. How much hormone was in your system at that moment that we tested, which to me is useful. Other practitioners, like medical doctors that don't have the same training, they will often say that that is variable and that doesn't matter. And in a sense, that's true, because the timing of when you do the testing matters. And if somebody's having a lot of hormonal imbalance symptoms and they're not tracking their menstrual cycles, then it can be hard to figure out, what do these hormones mean? So that's usually the reason why they don't test for them. But if we're doing a blood test, we're going to try to do it about, I've got a fly, we're going to try to do it about 7 days after ovulation. And the reason why is because we're going to catch that hormone peak of estrogen, and we're going to catch that hormone peak of progesterone, which happens about 7 days after ovulation. So we get to see, how much estrogen are you making, and also how much progesterone are you making, which is important because if your progesterone is high, that means we can confirm ovulation. And for women of childbearing age, when we're having our menstrual cycles, the goal, regardless of our fertility goals, should be that we ovulate every month, because that means that we're making hormones. Ovulation is how we make hormones as women. So it's really important. So a blood test ideally should be timed at the right time, but that also goes for things like urine testing and saliva testing. So yes, hormone testing in the blood can be confusing, but to me it's really useful, because if I know a little bit about you, say you have irregular cycles and we don't know if you're ovulating or not, and I want to see, like, hey, maybe do you have enough estrogen? Because if you don't have enough estrogen, sometimes that doesn't support a cycle. What are your cortisol levels looking like? What are your DHEA levels looking like? What are your testosterone levels looking like? Do you have any sort of progesterone response? If we test it randomly, maybe we're not catching that progesterone peak, but we're able to just see how much do you have in the system. And all that is useful for me. Because I can generally tell from somebody's history what's going on in your body and your symptoms, plus the labs, what is happening. So I always run blood testing on women. The other thing that I often will do as well as blood testing is urine testing. And urine testing is awesome because urine testing tells us how the body's metabolizing hormones. Literally, what is the body doing with hormones and what detox pathways is it using to get rid of it? Which is awesome, especially if we ever need to supplement you with hormones, especially if we're trying to figure out some pesky symptoms like why are you getting some chin hair growth, why are you getting male pattern acne, what's going on with your testosterone metabolism. It's really great for looking at methylation. We've been talking about COMT and MTHFR a little bit on here, so it looks at that. Urine testing is great for assessing for estrogen detox, because one thing that is interesting about estrogen is like Goldilocks. We want estrogen to be just high enough, but not too high. We want it to be high enough to have a regular menstrual cycle and to have good periods, but we don't want it to be so high that it spills over and causes estrogen overload symptoms and causes a lot of PMS. And one way we can help women detox estrogen is knowing about their own detox pathways, because we have 3 main pathways that we detox estrogen through, and 2 are more protective and more safe, and 1 is not a good pathway to detox through because it's more DNA damaging. And so, say we have a woman who we're thinking she has estrogen issues, especially with estrogen dominance in relation to progesterone, we can do a urine test on her and see what pathways does she favor, because maybe she just has a lot of estrogen in her system because her ovaries are creating a lot, and maybe she has a lot of xenoestrogens from the environment. But maybe she's detoxing it actually really well. Then that's useful, because if we find out that somebody has a detox pathway that has a problem, there are generally certain nutraceuticals, different supplements that can step in and help to push that pathway the way that we need to go. And so say we learn for this woman that she is an actually good estrogen detoxer, then we're not going to give her things to necessarily detox her estrogen better. We're going to help her lower her estrogen load from her environment instead. So it helps us get more nitty-gritty on what do we exactly need to do for you, which is great, because I love supplements because they help us get us where we need to go, but they also sometimes don't work because the pathway that we picked them for is working fine, if that makes sense. So sometimes supplements don't work because the pathway that they're meaning to support is either working okay or doesn't need to be supported. So that's why I don't say, for all women, okay, if we think you have estrogen issues, go take some DIM. DIM is helpful for stimulating the 2-hydroxy detox pathway of estrogen, which is the most protective and happy and healthy, but it also can lower estrogen. So for some women that are kind of on the fence about having just enough estrogen but not too much, we might not want to give them DIM because that will actually lower their estrogen a little bit. So we don't just put people on supplements, we test. So that's why I'm doing the blood testing, and that's why I generally always pair it with urine testing. And the urine testing that I use is called the Dutch test. And if you guys have not heard of the Dutch test is fantastic. What I love about the Dutch test is that for a relatively low price, it gives us a lot of good information, which is really important when you're doing a lot of testing to try to figure out, what your exact issue is. It needs to be tangible and you need to be able to apply it immediately. So I do the blood testing at a certain time of the month for women that have their menstrual cycles. If you're a woman that doesn't have menstrual cycles, say you're on the pill, then we can do it at any time. Or say you're in menopause, post-menopause, then we can run the test at any time. Or you're a man, we can run the test at any time. But for women that are having their menstrual cycles, we generally try to do it around day 21, depending on how long your cycle is. That's based on a 28 to 30 day cycle, but if your cycle is longer or shorter, then we adjust that time frame. So I will have women do the blood test on the same day that they do the Dutch test. And the Dutch test is awesome. It looks at your estrogen levels and your estrogen detox. It looks at progesterone metabolites. It looks at your DHEA and your testosterone levels. It looks at how you're detoxing testosterone and androgens in general, which are male hormones. It's looking at your COMT function. It's looking at your cortisone levels and your cortisol levels. It's looking at your metabolized cortisol. It's looking at free cortisol levels. It's also looking a little bit at oxidative stress and B vitamin use in the body, needs for glutathione. If you have issues processing your dopamine or serotonin, epinephrine, norepinephrine, it looks at that. So the Dutch is a really nice comprehensive way to see, okay, so your levels look like this in the blood, but what is your body actually doing with the hormone? So the blood testing that we do tells us what the body is making at that moment, what's running around in the blood, what hormone is in the body that's exerting the effect on tissue. And then the Dutch is showing us, okay, what is this person peeing out, detoxing? What are their biochemical pathways like? What pathways do we potentially need to support? So often, depending on the person, I usually always start with blood testing, because blood testing is a really great first step to see, hey, do we even need to go to the Dutch test to get that extra layer of information? Sometimes I have enough info with a history and symptoms that I don't even need to go that far. So for those of you that are listening and you're like, oh gosh, I don't know if I could, get a test like that. I don't know if I could afford something like that or afford both of them at the same time, or, I don't even know where to start. I would start with a blood test and a skilled practitioner. That is the key. And for both of these, you really need a skilled person, because the Dutch test is complicated. When I started running it on people, I had to get some major reps in and learn and get layer after layer of understanding of, some really deep biochemistry, which is awesome. But you have to go to someone that reads these things, fairly frequently, and does several of them a month, if not a day. And that is an important point, especially because I often will see people self-ordering some of these testings, which is awesome, because some of you guys don't have access to a naturopathic doctor in your area, or your doctor that you're working with isn't quite listening to you. And in that case, get a second opinion, find a different practitioner. But the fact that you can order these yourselves is awesome, but you have to find a professional and pay them to interpret it for you. Otherwise, you're going to be doing the approach that I was talking about before, which is, reading your test and thinking, okay, what can I do supplement-wise? And it won't have that same holistic lens, that same holistic type of treatment to really get to the root cause of the issue. Because not everybody needs DIM. Some people need, detox support. Some people need to get all the plastics out of their life. It's very, if you guys have been listening to me at all for a while, I'm all about the whole picture. And so you really have to look at that. But the blood and the urine, they help us to get the whole picture for your hormones. The only thing that the Dutch does not really give us a look at is a thyroid hormone test. So when we're talking about thyroid hormones, we really just have to run a blood panel of thyroid hormones. And this is really, really easy. And you can order this yourself, you guys, online at directlabs.com, which I'm not affiliated with. But for those of you that are going to your endo and you're going to your PCP and you're like, oh my gosh, I'm so sick of the fact that you won't order me a free T3 or you won't recheck my antibodies, my antithyroid antibodies, then definitely run the panel yourself, and you can bring it to your doctor and hopefully they will listen to you and help you. And if they don't do that, get a second opinion. You guys know that I'm all about the second opinions. So a thyroid hormone panel, you can just run in the blood, really, really simple. The way that I test for thyroid hormone is to do it first thing in the morning and not having taken any of your thyroid medication beforehand. And if you follow other doctors, you will know that there's lots of different thoughts behind whether you take your medication before or after your testing. I have patients take it after testing, and I have everybody do the same thing so that it's consistent. The area where that really matters the least is if you are on just a T4 only medication like a Synthroid, then it doesn't really matter if you take your thyroid hormone before testing. But if you are a person that's on like a T3, T4 combination, then it's best to take it after, because the T3 can make your levels go up, which is great, which is what we want, but it can look like it's falsely elevated on a test. So if you're getting your thyroid hormones tested first thing in the morning, don't take your thyroid medication. The other way that we can test for hormones is in the saliva. And this is a method that I don't use, full disclosure, because I find that it just doesn't work very well for me. It doesn't get me the results I need with my patients, and it always leaves me with question marks about, how am I dosing this hormone? What do their symptoms really mean? And so I ended up making the switch to blood and urine because that got me really the best results with people, which, that's what we're after at the end of the day. We're after results, because lab testing only tells us so much information about what's going on. The biggest thing is that your symptoms are improving and how you feel in your body is improving. And when we're doing all of this cool functional medicine and all this cool lab testing, it's important to have a balance of both, because every so often we get somebody where, they feel great, but their labs look like trash. And sometimes people feel like trash, but their labs look great. And so you have to be able to figure out what to do in that situation. And if you're kind of lost on that, send me a message. I might be able to help you. But there's definitely a lot of nuance to figuring out that balance. And so you want to find a practitioner that can work with you, that doesn't just look at labs and doesn't just look at symptoms, because they both really need to coincide. You need to be feeling well, and also your labs need to be looking good. So that's really, really important. So saliva I don't use. Saliva tells us free levels of hormones. And free levels of hormones is essentially when your hormones are running around in the blood, they're carried by a protein. And so before they get absorbed into the cell, the protein has to pop off, and then the hormone has to be absorbed into the cell. So it's getting carried around the blood like this, and then the protein pops off, and then the hormone is free, and then it gets absorbed into the cell. And the amount of time that a hormone is free and available like this is not very long, and it's different for each hormone. But because saliva just looks at free hormones, in my opinion, it doesn't really give us a great picture of what are you actually experiencing, because hormones do have an effect on you when they are bound in the blood. So it's not just what's hitting your cell, it's the other amount of hormone that's affecting your feedback loops in your brain that's actually regulating how much hormone that you're making. So I think the picture just needs to be a little bit more broad. Plus, I ran saliva testing on patients. I ran saliva testing on myself. I just did not find it useful. But that being said, there are some people that disagree with me, because there are some naturopaths that really love saliva testing, which, if they get results with it, that's fine. We want to get you guys better at the end of the day. But with my research and clinical experience and training, the blood testing plus the urine testing really has been the best fit for my practice in terms of getting you guys results, which is number one. So when we're doing all of this testing, it's important to do it at a certain time in your cycle. Kind of going back to what I was saying before. So if you're doing the Dutch test, which is a urine test, and you are doing the blood testing, then if you are a menstruating woman, you should do it about 7 days after ovulation. And if you know what your cycle is doing, you can find where that window is. And if you don't know where that window is, then you can figure out where that window is with cycle tracking. And cycle tracking I will do a separate video on this, but cycle tracking is essentially looking at your things like your cervical fluid and sometimes cervix position, depending on the method, and also basal body temperature tracking. And then some people do LH strip testing. And so looking at those 4 things, you can tell where your fertile window is in your cycle, and you can see if you have actually ovulated based on how your temperatures look when you create a graph, or what we call a chart of your temperatures. We can find out exactly where that about 7-day after ovulation window is, which is awesome because then we can get better testing. And I love temperature tracking, and I love women when they track their cycles in apps and if they have a notebook, because we can see their hormones improve over time, which is really important because often hormones start to shift and women start to feel different. And maybe we're starting to get an ovulatory rhythm back in a woman that's not previously ovulating. But she might be feeling better, or she might not be feeling better, but we might be seeing improvements in her chart that will definitively tell us, hey, we are, your body's trying to ovulate more frequently, or you are actually ovulating, which is really, really important, especially when a woman is coming off of birth control, or a woman is trying to become pregnant, or a woman is trying to avoid pregnancy, or you're someone that has irregular cycles like PCOS. Like, you guys, for all of you PCOS gals, I cannot stress enough how useful cycle tracking can be for you. I just can't say it enough. It really helps us determine when your body is starting to shift into having that normal ovulatory rhythm, because that's the goal of treatment, is to get you to regular cycles so that you don't have your symptoms, so that you can get pregnant, so that you don't tear your hair out, all those types of things, so that you can feel normal. So cycle tracking is often just a really, really important way to know that these treatments are working, especially when we're just talking about women's sex hormones. So we talked about testing, and thanks everybody for popping on. We talked about hormone testing. We talked about hormone testing for thyroid, adrenal, and female sex hormones. We talked about timing. The only other thing that I'll probably mention before we finish up is adrenal hormones. A lot of practitioners will test that in the saliva, which is the third method of testing that I was mentioning before. And that can be useful, but I don't always see it reflective of symptoms. But when I started years ago doing urine and blood to really get a full adrenal picture, that's when I really started to get movement with patients and really be able to definitively say to them, hey, you have adrenal dysfunction because of that stress that went on last year, and here are the effects, the tangible effects. It's on a piece of paper. We can do something about it. And then that's when people really started to get better. So I'm a big fan, even with adrenal testing, of doing urine testing, because it actually gets us where we need to go. And for this urine testing that I'm talking about, when you're doing these tests, definitely make sure that you're not doing it on a crazy, crazy day, or a day that you're really stressed, or a day that's not your normal schedule. Do these days on days where you have the normal amount of stress that you always do, and you don't have any crazy new commitments or new places to be, because we want to have the test really representative of what is your body going through on the daily. What is your body going through almost every single day? So that is really important. So if any of you guys have questions, thank you all for coming. Please let me know. Otherwise, this video was all about my approach to hormone testing. So if those of you that are logging on missed it, definitely go back and give it a watch. I post these on Instagram TV and also YouTube, so you will have them. But this approach of doing the blood hormones plus the Dutch is really something unique to me that I kind of made up along the way. I don't know of other as many other practitioners that do it in the same way that I do. There are some similarities, of course, because, my fellow colleagues, naturopaths, we're doing similar things. Oh, you're welcome. But this is something that is very specific to what I do in my practice, because I work with a lot of women specifically on their hormones, whether they're getting off the pill, whether they're in menopause, whether they have period problems, whether they have PCOS, endometriosis, whatever it is. And so the testing ends up being super, super, super useful. And a couple of you guys that are on here, I know that you've had this testing, and I know that it has been super beneficial for you, and you guys are actually getting results. And that's the point. Like, we want you guys to feel better. And it takes time for all of you guys that have been put on a hormone treatment plan, that have put yourself on a hormone fixing plan. Definitely give it time. It takes time. The way that I think about it is, it takes time for the brain and the ovaries, if they're like trying to like establish a new communication loop. It takes, about 3 months for that to happen. It takes time for nutrients to get into your body and really trickle down to the ovarian level, which is not really a scientific or medical way to explain it, but this whole theme of 3 months to really start to see effects of like certain supplements, certain dietary changes, whatever it is, it takes about 3 months to get things going. And if you're a person that has results sooner, awesome. That definitely confirms that we're on the right track. But if it takes some time for your body to respond, sometimes it's because, your levels were down here and baseline is up here, and we're trying to get you up here to optimal health. And, we had to get you up to baseline before your body could get anywhere. So sometimes it takes some time. So if you guys are working with somebody, or you have made some changes on your own after watching a lot of my videos or somebody else's, definitely give it time. I can't stress that enough. I think at least what I see in my younger patients, those millennials, is that we all tend to be wanting results really, really quickly. And I don't blame you, because if you've been suffering from hormonal imbalance for, years before you sought help, it sucks to wait longer, but I promise you it works, and it just takes some time. So if you're working with a practitioner and it's taking a little bit of time, or you're making some changes and it's not quite working, give it some time. If around the 6 months and you're really truly committed, and you're not seeing any results, then that's when I would either call up your naturopathic doctor, go see a naturopathic doctor if you're trying to do this DIY at home, get some help. One thing that's cool about the hormonal world is that you really need some help to go through it, and you really need an objective way to look at it. Because with women, our cycles, they happen every month. We get kind of used to them. And so sometimes we don't see change unless someone's objectively saying oh yes, your energy went from, a 5 out of 10 to a 9 out of 10. Or, your energy went from, your cycles went from, every 38 days to every, 32 days. That's a huge improvement. So it's good to have someone walking you alongside to really also encourage you, but also to make sure that you're on the right track. Because one thing that I see a lot in hormone land is that because there's a lot of free online resources, a lot of people will self-help, which I'm totally not against, but some of you guys need to call a naturopathic doctor and actually go see one of us, because you'll end up spending way more money kind of DIYing it than you will actually with working with a practitioner. So I'm super pro working with a practitioner. You guys know me. Help save yourself some time, because time you can't get back. You can't get back the years that you waited before you wanted to balance your hormones. You can't get back those years, that your periods were killing you. You can't get back those years of just, waiting to fall pregnant. Definitely don't wait. And I'm so passionate about this because there's so many really, really tangible things that anybody can do to help their hormones. So I hope you guys found this useful. Tonight we had a whole chat about blood, urine, and saliva testing and what to think about for thyroid, sex hormones, and adrenal hormones. So I hope you found this useful. If you did, share the video. That is how this message gets out, because I'm trying to help women learn about their cycles, learn about their hormones, so that we can stop this whole epidemic that we have in this country and really in the world of women just having horrible periods and super high stress and not being able to have babies and, period problems and menopause problems. They are preventable. So if this struck home, share it with your friends and give me a follow. I'm Dr. Meg, and I'm a naturopathic doctor, and I see patients virtually in California. So if you are in California, send me a DM. Let's connect, because it's time to get your hormones balanced. Like, girl, what are you waiting for? Seriously. Don't let another minute go by. And for those of you who are regular followers, thank you. And for those of you that don't know, I do this every Monday night at 5 p.m. Pacific. So if you want a daily dose of Dr. Meg and random medical knowledge about women's hormones and gut health, then this is the place to be. And if you miss them live, I always post to YouTube. So if you're on YouTube, hi! Good to see you. Glad that you're here. And definitely come over to Instagram and find me, stalk me, find what I'm about. Get all on top of this free info. This is the way that I can give back to you guys so that you can, do something with it. So I will see you guys next week. I don't have my planner next to me that's telling me what next week is, but I'm going to post it up after this video is done. So after this week, it is going to be a whole new month of April, and I have a whole bunch of lives planned. So stay tuned. It'll be a great month, and thanks everybody for tuning in. Have a great night.